Welcome to Evergreen Women's Health. Today we're talking with certified nurse midwife Stacie Hanna about her path to midwifery and what it's like to be at Evergreen Women's Health. Welcome.
Thank you.
So first of all, tell us a little bit about your background and how you eventually came to Evergreen.
So it's actually kind of a funny story. I've loved women's health for as long as I can remember. And I remember my dad had just gone hunting and he was gutting a deer, and I was a young child and I was taking photos, of all the pieces. And my mom was mortified. And she said, well, why are you doing that? And I said, well, I don't know. It's kind of cool. I think I'm going to, deliver babies one day. And then it was, I was a kid, so we kind of just ended the conversation there. And so when I became older and started actually moving into, what I wanted my career to be, I always kept coming back to women's health. So actually, before I became a nurse midwife, I worked as a labor and delivery nurse for 11 years. And that was just a really fantastic way to kind of solidify what I love to do and really help me to kind of hone into to specifically labor and delivery, but to just women's health in general.
Well, tell me about your schooling.
So certified nurse midwives are nurses first. And so I actually first went to the University of Oregon and got a degree in exercise physiology. I didn't know if I was going to do the nursing route or, become a physician. And then I met my husband and we ended up moving back to Roseburg. And then I went to nursing school and then got my bachelor's at OHSU in nursing, and then my master's program for nurse midwifery at Frontier Nursing University out of Kentucky.
Okay. And now you're back here in Roseburg at Evergreen Women's Health. Did you always hope that you would end up landing back here in the Umpqua Valley?
Yes. I always knew I wanted to come back to Roseburg after college and make Roseburg where I practiced. We have a really unique community that in rural health that is really special. It's really interesting for me too to see kind of how the way my career has really come about, because when I was younger, Dr. Tim and Dr. John Powell were our family doctors. And so now that I get to be working with them to some capacity at Evergreen is really special. I've always felt that Roseburg in general is very progressive in the relationships between the midwives and the OB-GYNs. It's not like that other places. It's very kind of separate. And here we really work collaboratively to be able to provide women with their full scope healthcare needs. But that collaborative care between OBs and nurse midwives is really, I believe, what helps to allow us to provide excellent care to these women.
What is a midwife? I guess that would be kind of a basic question. Maybe I should have asked that first.
It actually, people ask that a lot. So midwifery care is full scope women's health care. So from menstruation to menopause, including pregnancy, labor, birth, postpartum care. We really provide that kind of holistic, patient-led care throughout a woman's lifespan.
And you have talked about in other conversations we've had that one of your passions is the opportunity to talk to women of all different ages and have an impact on their lives. And you use the word empowerment. Why?
Because I think it is something that is really underappreciated. When we talk about just in general, like, oh, that's so powerful, or oh, that was a really powerful thing. But nobody makes the connection between power and empowerment and your healthcare. I feel like the culture of women's health has changed a lot over the last decade, but especially in the last several years, where now women are really allowed to speak up about what they need in their healthcare from their providers, whatever it might be. And so I think it's important that women never lose and never forget that they deserve that power. So they should feel empowered when you make a hard choice or decision about something that you're going through, in healthcare or not. But we should always feel, and women should be allowed to feel strong in their choices.
And I think that probably requires good communication and trust and all those really deep things that don't always, I think, probably take time with a health provider. So there must be great satisfaction when you go through that process. You earn their trust, you help them to feel better, and their life is better.
Well, and you know what's really cool about nurse midwives is that we were nurses first. And so, you know, there's a reason why nurses year after year are voted the most trusted profession in the country. I mean, it kind of makes sense. So as a provider now, I get to use all those nursing skills, I would say, you know, holding the patient's hand, being at the bedside, spending those extra little nuggets of time with them to find out about their family or their children or their pet even, you know, to really utilize all of that. And I know without a doubt it has made me a much better provider than I think I would have been prior to this.
So tell me about what makes Evergreen Women's Health unique.
So as a nurse midwife, I don't perform surgery. So if I had a patient who ended up needing, say, a cesarean section, what's really great is that I know that the surgeon who will be doing that will be one of the obstetricians that I work with. And there's a really good chance that that patient has already met them throughout their prenatal care. Another really unique thing to Evergreen that has been huge in my practice is that we have, you know, we're treating the whole family. We're talking about the holistic family care. So if it's somebody needs counseling or they need a primary care provider or a pediatrician, we have all of that right there in-house. And so it's super easy to put in a referral. We actually have counselors downstairs that we can do what's called a warm handoff, that even during their visit while they're there, we can have somebody come up and talk to them. And it truly has changed my practice, because then I know not just my patient, but her entire family is well taken care of.
Feels like support for you and the patient and everybody involved.
Definitely. And because we all are working together, communicating together, I can keep even better tabs on, you know, making sure some of these needs are met.
And you get to work in an amazing building too.
Oh, it's incredible. I look out my window every day and just think, how did I get so lucky? It's quite amazing.
That's terrific. All right. Well, Stacie, thank you very much for stopping by.
Thank you.
All right. Stacie Hanna, certified nurse midwife at Evergreen Women's Health. You can see more about Evergreen Women's Health online at evergreenfamilymedicine.com, and you can follow Evergreen on YouTube, Facebook, Twitter, and Instagram.